Yeah, so good morning all. It is a pleasure to have Dr. Sucheta Dandekar on this platform to further enrich knowledge in medical education for our faculty at AIIMS Patna. And I would like to give brief introduction of Dr. Sucheta Dandekar, who has been here earlier to be a resource person for conducting a workshop on mentor-mentee program here at AIIMS Patna. Please mute yourself. Please mute yourself. So, Dr. Sucheta Dandekar, formerly professor and head of Department of Biochemistry at SAIT GS Medical College and KEM Hospital, Mumbai, is presently professor of biochemistry at IRAS Lucknow Medical College, Lucknow. She is also adjunct faculty, Manipal Academy of Medical Education. Health Education, I'm sorry. A prolific writer, she has to her credit a number of books and publications in national and international journals. Dr. Dandekar is an active member of GSMC FAMER and PSG FAMER regional institutes. She is also presently global faculty at FAMER Philadelphia. Dr. Dandekar is a recipient of many awards and orations, one of which is the Best Teacher Award by the Maharashtra University of Health Sciences. She has presented her research work at a number of national and international conferences. A FAMER Philadelphia 2010 fellow, she was awarded the International Fellowship in Medical Education and received the Masters in Health Professional Education, Keele University, UK. With this brief introduction, we welcome Dr. Dandekar to start her session here. Thank you, Dandekar.
Thank you, Dr. Sharma, for those kind words. And thank you, AIIMS Patna, for inviting me to do this session. As you must have noticed, medical education or education technology, for that matter, is very close to my heart. And it's not at all a punishment for me to take such lectures. In fact, it's always a pleasure. So, and I enjoy doing it. With that, let us see what we can do as far as interactive teaching learning methods are concerned. The whole system has changed. We are into online teaching also. But what I have done is I have chosen things that we can use offline and online. That is what I thought we would do, so that we are able to use interactive teaching learning methods. What I will talk about, we can use them for both online and offline. I hope you are able to see my slides now. So I would like to acknowledge Bill Burdick and Ray Wells from FAMER, with whom I have conducted many workshops and many sessions on interactive teaching learning, and Dr. B.V. Kohli too. And some 2-3 slides I have taken from Dr. Ram Narayan from Manipal, Vice Chancellor. Dr. Ram Narayan from Manipal, who has a YouTube video on the vanishing art of lecturing. So I have picked up a few slides from there as well. So acknowledgements to them. I'm hoping that at the end of the session, we will be able to discuss and the strengths and weaknesses of the various teaching learning methods and implement strategies to facilitate learning in both large group and small group. This is what we usually see. You know, someone is talking and the people in the audience are invariably saying, "What a bore," or "I stopped listening about after 5 minutes," or there's someone who's just sleeping, or someone who's just saying that, "Oh my God, I need a change." So this is invariably what happens in most of the cases. But sometimes it does not. But I want you to take just 2 minutes and think of the best teacher you have ever had. And what did he or she do? And instead of sharing your story with your neighbor, you can share your story with all of us. You can put your hands up, or you can just unmute yourself and just tell me. It could be any teacher, it could be your kindergarten teacher, it could be your second standard teacher, it could be someone whom you met now as recently as yesterday and has influenced you so much. If we don't interact with each other, this whole session is useless because there's no interactivity there. So can I have someone to tell me? Yes, Dr. Bhabesh? Is that Dr. Bhabesh? Yes, tell me. Dr. Devendu, will you mute yourself? Dr. Sadhna, would you like to tell me?
Dr. Pratap is saying about class 7 teacher.
Class 7 teacher. So what happened? Oh, it's in the chat?
It's in the chat, ma'am.
Okay. Oh, great. So why did you remember this class 7 teacher?
Ma'am, when I was in class 7 and we are writing our examination.
Yes.
So at that time, we used to work in the night and reading up to 2 or 3 o'clock, class 7. But
Yes.
our teacher, he used to sleep along with us in our final exam. And he was not allowing to anybody to awake till 1 o'clock. He used to allow us sleep by 9 o'clock, then get up early in the morning for preparation. So that was most inspiring. And
yes, so he was very caring.
Yeah.
Right, and that is what you remember about this teacher. There are so many aspects that we remember when we think of our best teacher. We talk about fair to everyone. That is what I would say. That people who are able to communicate with us. They're able to focus on topics. They're enthusiastic. See, your teacher, Dr. Pratap, was enthusiastic about what he did and helped you. And he paid attention to the students' needs, right? He realized that all of you at that time needed a mentor at that particular time, and he helped you all. So when we think of a teacher who was, of a teacher who where you have a very bad memory, you feel just the opposite of all this. You feel frustrated, and the teacher was, ego-centered. And when the teacher favors some students, you start feeling very sorry about it. So these are aspects that we think about when we think of teachers. And that same, kind of feeling of well-being or feeling of what is going to happen in class, all that we sort of transpire in a class or in a large group. What is this picture depicting?
There is a teacher or there are many students.
Correct. So this is an example of a large group. What is this?
Few students with one teacher.
Excellent. So it's a small group. Any difference now between this and this?
Just the arrangement has been changed.
Yes. So what is the advantage for the teacher and the student?
When he or she can see each other's face and interact without any barrier in between.
Excellent.
And
Excellent.
There is no backbencher also.
Backbenchers.
So true. So true. Superb. Thank you for that. This is what they call the horseshoe. This is also similar. This is also similar to this semicircle, circle, or this is the horseshoe. So here, in both the cases, the teacher is able to see and the students are also able to see each other. And there are no backbenchers. Thank you. So we have many group methods, a large group method, a small group method, and individual methods. So when we think of a large group method, we think only of a lecture, but it need not be just a lecture. It could be, say, a symposium. It could be a panel discussion. It could be team teaching. All these are examples of large group teaching. And when we think of small group methods, there could be a seminar, a tutorial, bedside clinics, demonstration, practical sessions, dissections, workshops, group discussions. All these are examples of small group methods. In online also, we can use all these methods on an online platform by using the breakout rooms. In Zoom, all of you must have seen that we have breakout rooms. There is and you can put people into breakout rooms, and then you can help people discuss, and then you can come back and discuss some more. So online also, there is ways in which you can have interactivity. And the smaller the group, more the interaction there is. And of course, there is the individual methods like project work, assignments, self-learning, computer-assisted learning. When we give them a small module and say, okay, you answer. Or when we appear, I also have done some of those, free. Now, I mean, when the US asks us for $, we immediately multiply by whatever. Now I don't know what the dollar price is. Oh my God, I hate to think also. But whatever, we always have this habit of multiplying by the dollar price and saying, oh God, I can't afford this course. But Coursera is one place where you get a lot of free courses, and I tried those. So just to hone my skills during this lockdown. Of course, I was teaching also online at IRA, and then I did this self-learning courses, so many courses in medical education, and everywhere they had a component that had to be learned or studied. Now adult learning doesn't say you mug up anything, but you would read something and they would ask you questions. Once you answered all the questions right, you can go up to the next level. So this is an excellent example of distance learning. So what I'm trying to tell you all is that all of us, even in this situation, can work on having interactivity in our classes. But there are many factors which will involve, which will be involved in the choice of the teaching learning method. One is the group size. I think you have 250 students. How many do you have in MBBS?
It's 125 right now.
Oh, 125. How nice. What a relief. Even, at KEM, we used to have 250. So it used to be such a difficult task to, even look, if you looked at each student also in the class for half a minute, one whole hour would be spent. So 125 is an excellent number. So you can, have your choice of teaching learning method depending on the group size, depending on the resources and time available. When I talk about resources, I don't only talk about money. I'm talking about manpower. Suppose you have only 2 people in the department and you have to have small group teaching. So 125 students, you will divide into 60, 63, 62. So maza nahi aayega na. So you have to then decide, okay, I will have a large group teaching, I will have a lecture, but in that lecture, I will break them up into smaller groups. So all these things are possible. Then the domain of the objective. What is it that I want them to do? Do I want them to work with their hands? Do I want them to just have a cognitive? Remember, knowledge, skills, and attitude. Do I want them to know how to talk to a patient? So depending on what my objective is, I will decide on what kind of a teaching learning method. Should I show them a video? There are many learning styles that people choose, VARC. So will they only be able to hear? Should I show them a PowerPoint presentation? Should I show them a video? Should I show them a paper cutting of the latest, what happened related to the topic? All that can be done. And the level and nature of learning. Being a biochemist, I'm fortunate to be needed by most of the healthcare disciplines. So I will teach physiotherapy, I will teach occupational therapy, I'll teach dentistry, I will teach MBBS, of course, the medical college students. I will teach biochemists, a master's in lab technology or a diploma in lab technology, so many subjects. So, but if I try and tell whatever I'm telling my MBBS students regarding biochemistry to all these people, if I say the same thing, it will not be appreciated by the students, because they'll say, "अरे इतना पढ़ना पड़ता है क्या? तो हम डेंटिस्ट्री का डेंटल मटेरियल्स एंड ऑल कब करेंगे? हम फिजियोथेरेपी का बाकी के टॉपिक्स कब करेंगे? ये तो सिर्फ बायोकेमिस्ट्री ने हमको एकदम डुबा दिया." So there is, this fear in the students that is it really needed? And when you assess the student, you assess them completely, in a chotu short answer question or small things that you will ask them. And the student will say, "Ye pura itna bada kitab pad liya and it was not worth it at all." That is in the beginning. Slowly the students, their peers, their friends will tell them, "Arey wo biochemistry padho hi mat, kuch zyada nahi aata hai." Only they will ask you 4 questions and that you can study last minute and you will go. So if you preempt and if you understand ki this is the level of my student is different at each class that you're teaching, we can change the teaching learning method. And of course, we will take a conscious decision to cover the subject depending on what needs to be done. So you have another classification that I would like to talk about, which would be teacher controlled, lecture symposium, learner controlled, as in the small group teaching. And of course, as I told you earlier, the group based. So this I have already told you. All this I have told you. So in the words of Dr. Ram Narayan, Vice Chancellor of Manipur, former Vice Chancellor, he is now in the capacity of a consultant there. But he says this, and I just love this definition, so I'm taking it from him. He says, what is a lecture? That it is an uninterrupted rambling exposition of apparently trivial information delivered in a sleep-inducing monotone for 1 hour. So unless we help our students to wake up and talk to our students in a different way, this is what our lecture will be reduced to. So there are all kinds of lecturers, he says. They are obfuscators. What is an obfuscator? A lecturer who tends to just confuse people. ये भी बोलेंगे, वो भी बोलेंगे, इधर से निकालेंगे, and then suddenly say, on my trip to Alaska, oh, this is the slide to my trip to Alaska. So there will be so many things that the students will be so confused कि ये अलास्का कहाँ से आया, ये वो जब चाय पीने कैंटीन का एपिसोड क्यों आया, और फिर why did he talk about say lipids when he was talking about carbohydrate, and that kind of a thing. So he turns out to be a puzzler, a sort of a confuser. Okay. Then you have the regurgitator, a person who keeps on repeating the same thing again and again, year after year. In our time, we used to have some people who would take bring their lecture notes to class, where say, the pages are shriveling and they're falling apart, and people will have said the same thing again and again. So
same here also, ma'am. We have also observed in our pharmacology classes.
So we have this kind of a situation, but at the same time, what we want to be is, and that is why all of us are part of maybe this group of who is listening to each other, what we want are to be good facilitators. This is the kind of lecturer that we want to be. So there are characteristics of an effective lecture. You will find that I have put here 5 E's, that there has to be expertise. Remember, I need not know a particular topic very well or everything, but when I have to take a class, I have to see that I become an expert at it. So I have to, if I have to read one chapter, I should read one chapter from 10 other books so that I am very clear in my idea of what I want to say. I also need to engage the audience. I need to change the way I talk, my pitch, etc. And maybe I have to tell them, give them something to think about. Like in the beginning, when I started, I took you down memory lane. I tried to take you down memory lane and tried to say, which teacher did you like best? Yes. So maybe if you all were a little sleepy, you would sort of want to think at least, and those people who did not answer, maybe I'm hoping that they at least remembered their best teacher. So engaging the student. We have to hone our explaining ability. I remember when I first started teaching, I used to be very tense. I'm still tense. Huh? Before any lecture, I get butterflies in my stomach. I feel, Arey baap re, abhi kaise hoga? I keep on looking at my slides. So ye sab, I go through all this, even MBBS class. So, but that is I am the way I am. This is the way I am. But when it came to this explaining ability, I used to, because I was tense, I used to go do things very fast. Ki abhi ye kab khatam ho jayega? So I used to have this tendency to talk very fast and use my hands all over the place and walk. I used to walk in the class up and down, up and down. Then I made someone, a friend of mine, sit and watch me at the back of the class. And she said, "Baap re, Sucheta, तुम कितना हिलती हो, वो बच्चों को एकदम चक्कर आता होगा. And why do you talk so fast?" So with that, slowly I changed. And my then head of department, she said, "Sucheta, why don't you stand in front of the mirror and practice?" And at that time, no, I mean, I'm talking about, I started teaching about 37 years ago. So 37 years ago, we used to have this small recorder tape, this tape. And we used to have those cassettes. Many young people here may not even have seen those cassettes. So I would record my voice. And listening to that and watching myself in the mirror helped me or taught me how to talk and how to teach. So I honed I'm still learning. I still ask someone to give me a feedback, but I honed my explaining ability by doing all such things. And nothing can, stop our enthusiasm. And, we need to evoke interest in the patient, in all our participants, because that is what will help them to learn or want to learn. So the aim of a lecture should be not only to inspire, it is to be to inspire, influence, and to inform. What do you see as far as the font size of these words are concerned?
We mostly focus on information part. Font size means we should inspire most. Information should be less. But we usually try to inform more and more in lecture because we have only 1 hour. So we want to give as much information as possible in that 1 hour.
So true, so true. So that is what we have to stop doing, because we are talking to adults. We are talking to adult learners. So what we have to do is we have to inspire them so much about the topic that they will go back to their books and learn on their own. They will feel that, अरे ये तो पढ़ हम अभी इतना मालूम है, लेकिन अभी ये क्यों होता है? So the student is inspired enough and influenced enough by your lecture to go back to the book and read. So you need not inform everything. Google Guru is there. So many things are there. Information is available at the tips of everyone's fingertips on the keyboard. So as long as you be a guiding factor, the aim of the lecture should be enough. So there's no need to squeeze in a lot of information. They don't see that their concepts are clear and then tell them, "Acha, abhi jaake padho." So we need to use the ESDC approach, the environment, set, dialogue, and closure. This helps effective teaching. I think, may I request everyone to please mute their themselves?
Yes, okay, done, ma'am. I'm muting.
Thank you. Thank you so much. So the environment, there is the physical environment, there is the technical environment, your slides, mobile phones, distractors, mute, unmute, all those things, and psychological. You know, you could just keep on saying, what is this they're doing? Stop looking here, stop looking there. So all the time you're threatening someone, and it can sort of affect the whole class scenario. So you need to set the purpose of set the purpose. So you establish the relevance, you gain attention, and you link with the previous learning. You have to tell the students what we did last time and what I am building on now. And how do you set? By introducing yourself, asking questions, showing data or graphics, narrating a case scenario, or do anything that grabs the attention of a student. And then you have dialogue. And there are many verbal and non-verbal cues and questioning. So, you know, this part itself can be one whole lecture that I can talk on, you know, that how do you engage? This is what we're doing. This is what we're doing right now. We're going to do just so much engaging. But there are communication. We do a whole workshop on communication.
नेटवर्क रुक गया है. नेट गया. बैकअप यहाँ इतना गड़बड़ है ना बॉस.
For me, what am I trying to say when it comes to the lecture and when it comes to the attention of the students as time passes?
At the end of the lecture, the recall of students is much better when it is with the activity-based interactive teaching.
Yes. And also, what does it say? That the students' attention span, it slowly decreases. So jayenge idhar.
Yes.
Student will sleep. So in order to avoid and keep this graph like this, what do you need to do? In the middle somewhere, you need to give them some activity. You need to make them do something which will help. So the organization is so important as far as the whole plan is concerned. And that interactivity, has to be thought of. You can't just say, हाँ, मैं class में जाऊंगी, 10 minute के बाद उनको कुछ बोलूंगी. No, you have to think and you have to define the ground rules and you have to then put those interactive sessions in the class itself. Use of humor, use of anecdotes. You can, vary the audio visuals. You can show them a video clip and ask them to think about. You can give them an MCQ question. There are so many things that we can do. Okay. And of course, as I have told you earlier, summarize. So there are so many things that you can do in between that period in the graph that I showed you, that you could ask them to reflect. You can ask them to write down an answer to a question. You can ask them to swap answers with the person sitting next to each other, or you can put them into breakout rooms right now. You can have buzz groups. You can have crossovers. You can have brainstorming. You can have 3 minutes. One person talks, 3 minutes, another person talks. So there are many things that can be done. And in a large group, there are these 6 ways in which you can do things. You can do a think, pair, share. You can do jigsaw, concept test, quick things, 1-minute paper, and question of the day. What is the think, pair, share? Can someone just read out for me what I've written here on the slides? I want one volunteer.
It's about a think, pair, and share, ma'am. Am I audible, ma'am?
Unstable.
Am I audible,
Your
ma'am?
voice is not coming clear.
Hello.
Somebody saying it's zero.
Yeah.
Should I leave it? Should I leave it?
Yes, someone is audible. Yes. Please tell me. Yes, you are. Who was that?
So pose a question or a problem.
And of course, there is one thing called 1-minute paper that all of you can use. It is available online. You just have a look at it. You look at the image and you will see this, where this is optional. You need not tell the student to put the name. No need to, because then sometimes those students feel, "Arey bapre, fir apna marks kam ho jayega. We said ki we did not understand her. So she will not. She will, take revenge on me when the answers are given." So all these things that the student is afraid of. So we need not give them tell them the name. You need not write, but you can put the date. You can put the lecture title, and then you can ask them, what was the most important thing you learned in today's class? What question remains uppermost in your mind at the end of today's lecture? Means, what did you not understand? Or what is the question that further you have understood, but I don't know what will happen if this patient comes with this other symptom also. So the student is trying to think beyond. And the last is, what was the muddiest point in today's lecture? This is called the muddiest paper also. So what was the muddiest point means that what is it that I did not understand at all in this class? So when they write that down and the teacher looks through it, the teacher is also able to understand, okay, what is it that I was not able to tell the students properly? So in the next class, you can go ahead and take clarify the students' doubts and say, ye paper, in the muddiest paper, I found that some people had not understood this concept. I would know, where you break the whole big class into groups. We do this all the time. We do this in ERA also now. And we give them small topics to learn. This is an example of self-directed learning. SDL can be done very well with this. You give them topics to prepare. Then each group chooses one leader or one reporter, and that reporter then tells what they have learned. So they come back again. So the expert group 1, expert group 2, expert group 3 will come back again, and in the large classroom, tell what ideas they have learned about small topics. So in this way, if you are finding it difficult to finish your portion together, some topics which are easily understood by the student can be easily given into a jigsaw. So this is how you will fit in the two bookends your lecture, where you will have some kind of interactivity all the time, and that is what will help the class. So are there any questions up to now? Because I will then move on to a small aspect of small group teaching. Is there, or are there any comments, or would you like to tell me what you do in your classes? Is there anyone who would like to tell me? Or if you have seen all these methods, right, that I talked about, which do you think you will be able to use?
There is one question from Dr. Chandramohan ma'am. Am I audible?
Can you put in the chat box? Please put in the chat box.
What happened?
Dr. Chandramohan says, is it easy to regroup? Who's this? Dr. Chandramohan is saying, is it easy to regroup or return to the topic? Yes, it is very easy to regroup and return to the topic. It just takes about half a minute. But if it is properly planned and you have your IT department also with you online, you can do it. But offline, though, I have always used these all these techniques, and they have worked very, very well. And people come back together. So it is extremely easy. In fact, even today, I would have loved to use the breakout rooms and do things. But then I was not sure about how many people would be here and what we could do. But the next time we could use this technique, definitely. And we can, break up into groups and talk. Yes. So out of these methods that I talked about, 1 minute. Which method did you think is doable? Which method do you think that, I can use this in my large class? Is there anyone who will let me know? Ahana? I see Ahana here. I see Dr. Bhavesh. I see Preeti. I see Adil. I see Soma. I see Bandana.
There are responses in chat box, ma'am.
Okay. I'll look at the chat box. Okay, maybe people don't want to look. Think, pair, share. Oh, how nice. Jigsaw. Yes. 1 minute paper. How nice. See, question of the day. 1 minute paper and concept maps. So all of you at one time or the other are now understanding that this is something that all of us can do. And, we can always use interactivity in our classrooms and break that monotony that happens. And always remember that there is only so much that we can teach our student. Then it is up to the student to go ahead and read for himself or herself. We are talking to adults. So as long as you handhold a little bit and say, Abhi, itna tum aage jaake padh lo, it is enough to help the students to learn. Thank you so much. I'm so happy all of you have answered in the chat box. Yeah. So now we move on to small group teaching. So small group teaching is a face-to-face interaction carried out in a planned, organized, and democratic manner among members of a relatively small group, which is formed with a common purpose of achieving a specific learning objective. So you need to only have one or two specific learning objectives that you need to cover in a small group. So why would you teach in a small group? Can you tell me? Why would you want to teach in a small group? I can look at the chat. If people don't want to unmute themselves, you can tell me. Why would you want to teach in a small group?
Ma'am, can I?
Yes, Dr. Babish.
The advantage of small group is more interactive classes and
Correct.
more doubt clearance also. That a student can ask and more easily building the rapport, so that the understanding and flow of knowledge will be easy.
Yes, so true. So sometimes, we have introverts and we have extroverts. We have some students who go into a shell and they feel very afraid to open up in a big class. But if you are talking one-to-one, they will tell all kinds of stories. My granddaughter is like that. She will have a word and opinion for everything normally at home. But when it comes to the class, she will not talk. So I always tell her, why don't you go ahead and be out in the open? But it takes time. It takes time for such students to come out in the open, but they will. So the small group will help them to open out. So to impart a skill domain. So right, Dr. Pramod. We have Dr. Chandramohan who says individual attention possible. Yes, yes. So small group has its own advantages, and we should see to it that we use the small group in a very discretional fashion and a good way. So what are the advantages for the students? You can take their learning to a higher level of problem solving. You can have an opportunity if you want to show them a skill, you need a small group. And the last but not the least is the affective domain. Leadership, motivation, confidence building. In a small group, when people learn to talk, then they start getting courage to talk in a big class. So communication skills, public speaking, presentation skills. And in a small group, you can say, कि आज इसने present किया, कल ये नहीं करेगा. Next time I want X to say it. So you help students to open up and you realize, no, looking at the class only you understand कि ये introvert है, ये नहीं बोलेगी, कभी नहीं बोलेगी. So you then encourage, Adya, will you talk? Will you say this? And it helps. So there are many limitations of small group teaching. It could be time consuming. It could be resource intensive. It requires motivated teachers. And it needs awareness of group dynamics. Who is talking? When is talking? All this is also so important. And who is quiet? So, making a sociogram is important. That in a small group also, who talks the most and who does not. And preparation of the students by the students is important. And for the students by the teacher is also important. So there are many roles by the teacher also, knowing the group dynamics, motivating environment, facilitating discussion, and having the resource persons and having evaluators. Okay, so you need to hone all these skills. And as I told you, this is one workshop on communication that is possible or that we can do. So, and then these are the many strategies of engaging students. Crossover, think pair chair, you can see it's a small group teaching mode, which I have used in a lecture. So many brainstorming rounds, circular questioning, buzz groups, snowballing, syndicates, fish bowls, role plays. All these are, if you Google small group teaching methods or interactive teaching methods, you will find 1,000. You just Google. And there are umpteen, 1,000, hundreds of 500, 600 I have found. And each one with a description of that method. So there are so many methods. And why are we not using any of them? All right. So many methods that can be used. And these are the strategies for small groups that you can use. So I want you to do this when you go back. I mean, because it's already 10 to 12, and I would like to spend some time just that you teach, redesign it so that it becomes more interactive. And I would love you in your MEU group or to Sadhna, who I think coordinates this, to share the ideas. These are also ways in which you can even publish papers where you use some interaction, you see, get the feedback from the student, and you can also say what was your students' perception of using these methods. So that way you can get a publication too. So provided the study is properly scientifically designed. And always remember, feedback to the student is important and feedback to the teacher is also important. That is why that 1 minute paper is so needed, because that 1 minute paper can then help you to take it forward, and because that is your feedback of the student. So this is why I put this slide again once more. And most of you in the chat also have said that that there is so much of this. I'm just looking at the chat now, 1 minute. Individual attention, Shruti Singh says difficult concepts can be handled more efficiently. And there's someone who's asked a question. There should be small group teaching. It is demand of society. That is why we teach large group. Dr. Devendu, in a way, it is true. There should be small group teaching. But as I told you, it could be depending on the resources. Suppose you have just 2 or 3 staff members in your department, you may find it difficult to have small group. But you can. That is why I took that large group interactivity, that in a large group also, you can convert that large group into a small group. Do you agree with me, Dr. Devendu?
Yes, ma'am. Yes, ma'am.
You can do that. Huh? So, agar it is the norm, or we just have to take a large group, तो वो large group में भी आप small group कर सकते, and do it. It is so successful. I have noticed थोड़ा सा एक extra lecture शायद लग जाएगा, which you can tell this, but the students feel so enthusiastic ना, they say अच्छा हम आ जाएंगे वापस during lunch time for half an hour for a feedback. They come. But if you are doing something that helps student learning, I'm sure people will be able to adjust half an hour somewhere. So you have a small group, and then if your lecture spills over, you can also ask for a report out in the next class, and then give them something for self-study.
Yes, ma'am, that is important basically. Yes, ma'am.
हाँ, पूरा topic में ना, there are some things which only need to be mugged. कुछ कॉन्सेप्ट है नहीं, कुछ है नहीं उनको कि सिर्फ ये इतना मालूम चाहिए. तो those aspects you say you do, but discuss it, and then you give them a time period. कि in 2 weeks I will ask you 2 questions related to this topic which I've given for self-learning. You understand? And keep your promise. अगर आप नहीं पूछोगे ना questions वो 2 हफ्ते पहले के, then they'll say अरे एक सिर्फ बोलता है, कुछ नहीं पूछता, कुछ नहीं करता.
Ma'am, that is the one thing we don't find time to read ourselves basically. That is one of the problems.
But
we have to keep update ourselves also.
So true. I have this habit even now. I'm past 60. I don't want to tell my age, but even at my age, what I do now, because sometimes I don't get time to read something very. Yeah. Sometimes I don't get time to read a very heavy paper during the day because so many things happening, online class, so I sleep. Then at 3-3:30 बजे जो नींद खुल जाती है ना, so I get up, and for half an hour or 1 hour I read that paper, and I understand and I internalize it so that I can make slides which are easy for people to understand, and then I go back to sleep. My husband doesn't even realize I've gone out of the room. Come back. There are things that we have to do now. Otherwise, no, we will stagnate. We will become boring ourselves for people, and we will be boring for ourselves also. फिर life में कुछ मजा ही नहीं रहेगा. So you need to do that. This is one slide that is available on the net. You just say interactive and you look at the images. ये है. देखिए क्या क्या है. You have the lectures. you have interactive teaching and you have seminars, tutorials, and then there is the introduction, there is solving problems this type, summaries this type, writing questions this type, reading this type. So many, using all kinds of modalities are there. One slide explains it all, that you have so many ways in which you can do interactive teaching. So I hope I timed this earlier also. I went through the slides, I timed it. So because I always feel that if you are not a good role model, it is of all this is all, I mean, our going into the teaching profession is all useless. Okay, we are here, yes, for the salary we get and for the money we get, but we are here also, I hope, because we enjoy imparting knowledge. We enjoy teaching. And I hope that at the end of this, you have been able to understand the different teaching learning methods, their strengths and weaknesses. I hope you have now guidelines to effectively implement teaching learning method. I hope you've understood what is interactive teaching. And I hope that you've had tips to design an interactive lecture. And I want each one of you to do at least one interactive lecture class and see how it goes and let us know. Why? Because we are here as teachers to quench the thirst of our students, where quench means question, engage, and challenge our students to learn. It is so important because we're talking to adults, we're not talking to primary school children, we're not talking to school children at all. So we need to help them to question, engage, and challenge. And that is when all of us will be successful. So thank you for that.